Hello, my name is Carrie, and I would like to welcome you to Carrie's Kaleidoscope, where I discuss everything from interesting people I have met in my life to what it's like to be young and at the end of my life with some rare and unique diseases. I have been in the hospital since December 22nd. Today is February 7th or 8th of 2018, and I have been doing much thought about switching from palliative care to hospice, or as it's kind of known at this hospital, comfort care. Now, all of those words have a definition, and if you get too stuck on the words, you don't really get the treatment that you're looking for, or at least that's been my experience. Palliative care is care that is not focused on curative care, but instead on treating the symptoms cause and making the person comfortable. So, instead of giving a person a Band-Aid, you give them Toradol, which may help alleviate the pain better. When it comes to giving meds, which have side effects, as all meds do, you must evaluate whether the potential negative self-harm of those meds is something you are okay with or not. In my case, I am taking a high potency of an anti-inflammatory. I'm not really supposed to take anti-inflammatories due to some family genetic stuff, but it does help my autoimmune nerve pain, so I am taking it a little bit more often than what would usually be recommended for that med. So although I've been doing lots of thinking about comfort care / hospice, and in my opinion, communicating and advocating with doctors and nurses very well over the last few months, apparently I have been on palliative care, but not comfort care. And finally, today, I was able to make the move to comfort care. Now, you may be asking, why do you want comfort care? My pain can be better managed on comfort care because increasing opioids, we don't have to worry about side effects as much. And I now have access to a patient-controlled administration pump. I'm going to try and show you that. And that pump allows me to keep my pain in control as best I can. We are also slowly titrating my TPN down. Since I have a history of blood sugar hypoglycemia issues, they're dropping it at a slower rate than they usually would. There you see the comfort tying in again. My TPN will end on Sunday, and my PCA will have its full dosing amounts available to me at 2 o'clock. Oh, it is 2 o'clock this morning. So there's multiple reasons that I chose to go on comfort care / hospice. My autoimmune diseases are slowly increasing in their symptoms, and I just do not feel that this is a quality of life that I like. I am currently in a hospital room that I'm not allowed to leave due to the colonized MRSA that I have had for the last 10 or 12 years. I'm not super interested in going outside anyway, but that's just an example. Because I'm on the reverse isolation, nobody can touch me with their bare skin unless they're going to go wash their hands directly. They have to wear these fancy schmancy paper gowns and gloves, and really it's to protect the other patients, not so much me. But in doing this, an infection that we all thought would come sooner has not happened, and upon further thinking, I think that dropping the TPN is going to be the best way to go, and everyone seems to agree, so that makes my feeling even stronger. When I have had to make more decisions in this process, and I get this feeling of peace, of warmth, and of I made the right decision for me, and especially of relief. I believe all of those are coming from God, letting me know that I am still on the straight path, as there are many people that don't understand how you can be young and not have a good quality of life. I have people that do think if we just did A or B or C, maybe I could just snap out of it, and maybe it's really depression, and it's actually none of those things. It's not even about where I live physically in the long run. My body is done fighting. My pain has changed. Meds that used to work 5-6 years ago don't work anymore. I'm running out of access points for my central line. There's just a lot of stuff going on that is not easy to deal with. Plus, I want to end this in my own terms, per se, in a natural way. I don't want to be waiting for that fourth infection to come swoop me away. I am making the choice now. And of course, nobody that picks this as their choice wants to actually die. There is a huge difference between suicide and hospice, which will be its own video, I am sure. But I wanted to thank you for watching the video, and I'm going to do as many videos as I can. At some point I will become unconscious and unable to express through speaking. And I'm also writing when I can. I don't know that I'll have a video up every day or a couple every day, but we'll just see what happens. I'm just leaving whatever legacy I can leave, and I hope that you have found this educational. Please subscribe if you haven't already. Please click the notification bell as well, and it'll tell you when I post a video. And if you have questions or ideas for future videos, don't hesitate to ask. One of my things about my life is that I want people to be educated about it, straight from the beginning all the way to the end and back again. To my family and friends, I love you and always will. And here at Carrie's Kaleidoscope, we end each video with "One drop raises the sea" from Dinotopia. Well, I actually don't know how we end the video because I haven't ended many, but I was going to end with this one by saying, follow your heart and fly high.